So what I'm going to be talking about to keep the happy vibes going is the way that Medicaid work requirements caused coverage losses, not through noncompliance with working a requisite number of hours, but actually through a concept called administrative burden. And Nicole teed this up really, really nicely in highlighting the reality that most Medicaid beneficiaries are working. So even if you buy into this narrative of deserve, you have to earn your way toward health insurance, most people are still doing this, but we end up sort of running into these administrative hurdles. So just to get everyone on the same page, I want to draw on the administrative burden framework laid out in Pamela Hurd and Don Moynihan's 2018 book, Administrative Burden Policy Making by Other Means. Now, the sort of classic definition of administrative burden is your experience of a policy's implementation as being onerous. So, red tape, the hassle factor of being able to get the benefit to which you're entitled. So one critical example of administrative burden is in the length of time it can take to enroll in SSI. Averages around 6 to 8 months, and consequently, because there are so many hurdles to enroll and is so difficult to get accepted, it has one of the more notoriously low rates of policy take-up. And being enrolled in SSI or SSDI, very important in Medicaid work requirements if you have a disability and are unable to work. So what is embedded within this concept of administrative burden? There are three layers of costs. There's the learning costs. Essentially, what is this program, in this case, a Medicaid work requirement, which could better be characterized as a paperwork requirement, but essentially what is being expected of me, the compliance cost of the actual burdens of documentation, and the psychological costs of stress, anxiety, frustration. So, what do we know about the Medicaid population? Well, what we know is that, according to the Kaiser Family Foundation, 92% of Medicaid beneficiaries already work or would be exempt because they're students, disabled, or caretakers. So, this is why, basically, what we're going after is 8%. Now, you wouldn't know that from the narratives that we're hearing around this bill, and that Nicole nicely laid out. This idea of, well, we don't want able-bodied people to not be working. Well, that isn't really the case. So this isn't so much a compulsion to work. It's really a compulsion to document. Now, when we don't have a lot of work requirements in effect right now, but we can look to the 2018 case of Arkansas. So in the first Trump administration, Trump encouraged states to submit Section 1115 Medicaid waivers to implement a work requirement. Arkansas was the only one to implement it. And what did we see? Well, Ben Summers at the Harvard University and his colleagues have a couple of articles, one in the New England Journal of Medicine, another in Health Affairs. So it was implemented in June 2018. By early 2019, 18,000 people in Arkansas were notified that they had been removed from Medicaid. There was a 6.8 percentage point decline in the share that were insured through Medicaid or the ACA. And notably, there were not corresponding increases in employment. A lot of the challenge was because of these learning costs and the compliance costs, which is to say, about a third of people did not know that there was a Medicaid work requirement. And there, even among people who had heard about the requirement, there was widespread confusion about whether it applied to them because they were thinking, well, I am working. I don't need to do anything else. Well, they actually did. And so about 44% of people were just unsure to whom it applied. And that's not great. Um, Now, in March 2019, a judge halted the program implementation. And again, the challenges here were not that Arkansas Medicaid beneficiaries were not working. It was that there was limited policy visibility and it was a complex documentation process. The Kaiser Family Foundation actually lays it out where you have 5 security questions, you have to link it to a reference number that came in the mail, and you may be moving around addresses. There was an 11-step process to document work hours. It's also particularly onerous if you're working multiple part-time jobs for which there were additional questions. Some people have inconsistent hours, some people have gig work, and these people are more disproportionately Black or Hispanic. And so, and this obviously comes at a health cost. So 50% of those who were disenrolled from Medicaid reported serious problems paying off medical debt, most delayed care or delayed taking medications because of this increased medical cost. Because as you may have heard, healthcare in the United States is quite expensive. Now, another current case to which we can turn to highlight the challenges that arise in the setting of these paperwork requirements is Georgia's pathways to coverage. So Georgia did not expand Medicaid. They have one of the most restrictive Medicaid programs, if not the most restrictive. But they implemented this pathways to coverage program, which has an onerous paperwork requirement. Now, over 110,000 Georgians demonstrated interest in applying, but just 4,231 people were actively enrolled at the end of its first year. And so what we see is this really big gap between people who are interested in enrolling in this program, people who actually apply, and people who do so successfully. Now, you might think, well, it's just a few thousand people. At least it's not costing the state a lot of money. Well, you'd be surprised. So the Medicaid paperwork requirements actually do take a lot of resources for the state to implement. Georgia's Pathways to Coverage program is now enrolled about 7,000 people, and it is costing the taxpayers $86 million. And so one of the common talking points around the bill has been, well, this is fiscal conservatism. We want to rein in spending. We want to cut costs. And the reality is actually more of a cost shifting. And so in 2019, when there was the litigation around the Arkansas Medicaid requirement, the GAO solicited from 5 states cost estimates for implementing the Medicaid paperwork requirement. This did not account for all other costs over the course of the demonstration. Now, you may notice that there is very wide variation across these 5 states. There were different technologies, different reporting systems, different sort of levels of documentation required. But overall, we can say it's very expensive. So these states reported the number of beneficiaries and the aggregate cost. And so this shakes out to a range of $84 to $463 per person to implement, with a median of $227 and a mean of $267. So now what does this mean for implementing a nationwide Medicaid work requirement? Well, we haven't done this before, so there's a lot of uncertainty. But what we do know from the Center on Budget and Policy Priorities is that somewhere between 9.8 and 14.8 million people would be at risk of losing health insurance under the Senate plan because the Senate extended Medicaid paperwork requirements to parents with children 14 and up. And so what does it mean for them to be at risk of losing insurance? Essentially means they would be subject to the requirement and not automatically exempt. And so based on the 2019 cost per person to implement, What I provided here is a range of possible implementation costs, whether on the lower bound of 9.8 million or the upper bound of 14.8. And what we see is really staggering numbers. So the lower bound is 823 million, the upper 6.85 billion. And this is going to involve a lot of employment of government contractors, leading Code for America founder to characterize such provisions as welfare for Deloitte because of this added reliance to verify employment and so forth. But this is all to say that Medicaid paperwork requirements are overwhelmingly targeting people who are already working, but may have difficulty demonstrating it, whether due to low technological literacy, low awareness of the program, onerous technical requirements, or piecing together part-time work or gig work that is just more difficult to document. And not only that, but these administratively burdensome provisions actually end up costing the government quite a bit to carry into effect.